Thanks. I'm Dr. Snyder. I'm one of the attending physicians at Stony Brook Medicine, OBGYN. And the purpose, thank you for inviting me today. I would like to give a brief overview of menopause, and the purpose is to provide information that will help you as women discuss any of the symptoms you're having and give you enough information to discuss these with your primary caregiver. The purpose is not to give medical advice, because I can't do that unless you're my patient, but I will arm you with enough information, and the PowerPoint slides have been given to the library. I hope we'll have time for questions at the end, okay? All right, so let's get going with this. Okay, so menopause, okay, it can be life-changing because it can have an effect on your work life, your social life, and your sexual life. 45% of women at the average age of 51, which is menopause, can experience menopause. And of those women, the most common symptoms are, I'm going to go to the next slide. The most common symptoms are vasomotor flushing, hot flashes, night sweats, and I want to touch upon them during the presentation a little bit later on. Of the 1.5 million women who go through menopause, 80% of them go through some symptoms. They could be mild or they could be very heavy, and we'll talk about that too. The average age for the symptoms, the average age for the symptoms is anywhere from 4 years, but it can be up to 12 years. And I want to go back to the first slide here. 45% of women, okay, will experience these symptoms. Okay, some facts for you, okay. This was a little bit out of order. My dog, by accident, stepped on my PowerPoint last night, and I had to rearrange all the slides. 75% of women will experience symptoms, as I said before. 25% of these women will have very severe symptoms, which could be life-changing. And usually the average duration for these symptoms is approximately 7 years, okay, and sometimes up to 12 years. Okay, a lot of questions. You may have women going through menopause may think, what's wrong with me? What am I going through? You're not alone, okay? My best advice to you is when you see your primary care provider and they ask you if anything else you want to discuss, ask them or talk to them and saying, I'm having these symptoms. Am I going through menopause? What do you think is going on? I want to give you some information, just some definitions, okay? First of all, this may be very basic, but just so you know, the ovaries, okay, they're the main estrogen drivers in the body. They produce 3 very important hormones: estrogen, progesterone, and testosterone. What happens in menopause is the estrogen, or estradiol as we call it, starts decreasing. So the definition of natural menopause is an absence of periods for 1 year, okay? If you have periods for 8 months, and then all of a sudden, if you have no periods for 8 months, then all of a sudden you have a period at the 9th month, you're not in menopause, okay? After 12 months of no periods, then you're definitely in menopause. Any bleeding that occurs after menopause needs to be evaluated. So natural menopause is when periods stop naturally, okay, for 12 months after your last period. Early menopause, sometimes women will undergo early menopause at 45 years old, okay? Late menopause is after age 54. I've had patients who have don't go through menopause until they're 58, 60 years old. So just discuss this with your primary doctor, okay? Induced menopause. Some women, for example, unfortunately, if they were tested positive for what we call the breast cancer gene, if they're done with their reproductive years, they may elect to have their ovaries removed, because ovarian cancer is also implicated if somebody has breast cancer and tests positive for what we call the breast cancer gene. So that would be induced menopause. The ovaries are taken out. The estrogen supply of the body is severely depleted. Also, there could be certain disorders such as diabetes, rheumatoid arthritis, genetics, a thyroid disorder that can lead to induced menopause. Perimenopause is a very important time. This is the period of time when periods start becoming irregular before menopause. It is usually the period of time when our menopausal, perimenopausal symptoms and menopausal symptoms are the worst. And perimenopause usually starts at age 42, and it can go on up until menopause, which is the average age, as I mentioned, is 51. You may not have any symptoms, you may have a lot of symptoms, but perimenopause is where this all starts. Okay, let me get the next slide. All right, stages of menopause. Okay, as I mentioned before, premenopause is the period of time leading up to perimenopause. It's when we are at our peak reproductive years. And between age 35 to 45, when the last period would occur, excuse me. Perimenopause, usually age, may say about 41, 42 to 51, which is average age of menopause, is the period of time when you are having irregular periods, night sweats, hot flashes, loss of libido, all these wonderful symptoms, but they can be dealt with. Perimenopause, again, is a period of time from 51 years old, cessation of periods for a year. Postmenopause is a time when we diagnose a lot of osteoporosis, a lot of what we call painful intercourse dyspareunia, a lot of vaginal infections, a lot of urinary tract infections, and I will go over them with you. Time between a woman's menstruating years and menopause, when the periods end. It's different for each woman, but it can be debilitating. Again, symptoms may vary and may or may not include menstrual irregularity. You may have, for example, a period January, February, March, skip April, May, June, have another period in July, August, or your next period in September is dark brown blood. That is perimenopause, okay? You may also have a lot of sleep problems. All right, a lot of symptoms of menopause, and these are kind of scary when we look at them, but we can help you with this. Okay, I want to focus on the main ones, such as hot flashes, night sweats, vaginal dryness, decreased sex drive, thinning hair, urogynecologic, urinary changes, and I'll give you some suggestions if that helps. Once again, it's very important to note that menopause has a lot of multifactorial symptoms. For example, there could be psychological symptoms. There could be anxiety and depression. Again, fatigue, physiological symptoms, loss of libido, headaches, tiredness. Okay, so it's all encompassing. Again, major symptoms, hold on a second, sorry. Major signs and symptoms, these are the main ones: hot flashes, night sweats, urinary incontinence, urinary tract infection, vaginal changes. And I'll touch upon all of these. Skin and hair changes, inflamed or irritated urethra. The urethra is the organ in which urine exits the body. Weight gain, that's a big one. Just so you know, estrogen is the hormone that's very important in all of this, all of menopause, but I just want you to see the average estrogen levels as we age. The red shows the most significant, the highest estrogen level, which really peaks around age 35. And then if you notice from age 40, then 50, 60, 70, and 80, the estrogen level becomes deficient. All right, let's talk about some changes. Okay, and as I mentioned before, not everyone has the same changes. There could be a narrowing of the vaginal opening and the shortening of the vaginal length. Okay, that is not uncommon. Dyspareunia, which is pain with intercourse. Fissures, they look like little paper cuts on the labia. And they could be very painful, especially if urine hits these little fissures. Labial fusion. The labia, and I hope I'm not being too basic, are the two, we call them the vaginal lips, okay, and the genital area. And there's a labia majora, a larger labia, and a smaller one. A lot of times when we reach menopause and we have a lack of estrogen, those labia will fuse. A pale and dry vagina. I like to give the analogy when I'm doing my pelvic exams on patients and placing the speculum in. If they are estrogen sufficient, okay, young reproductive age, I kind of compare the vaginal walls to waves or sand dunes, okay? They have peaks and valleys. We call them rugated. When we reach menopause and have a lack of estrogen, the vagina looks pale and atrophic, and it almost looks like the pale seashore, okay? Even that paleness, when we have intercourse, that can bleed, okay? So it's very important to try to treat this. Treatments for these specific genitourinary tract infections could be pelvic floor PT. We have wonderful pelvic floor physical therapists in the area who really help out, and I depend on them and use them quite a bit. Vaginal dilators, especially if the vaginal opening becomes narrow. When people abstain from intercourse for a while, the vaginal opening can be very small, okay, and narrow. Vaginal dilators help. Also, vaginal lubricators such as coconut oil. I recommend a lot of times women go to the grocery store, and where they sell the oil, coconut oil is solid. I recommend organic, okay, coconut oil. If they take a little ball and a little scoop of it, roll it in a ball and place it in the vagina, the body heat melts it, and it could make intercourse much easier. However, if you are using condoms with intercourse, if that's an issue for you, do not use coconut oil, because that will make the condom less effective. Vaginal vaginal estrogen. Now, this is by prescription, but it's very effective. It comes in pills, it comes in creams, it comes in rings. You have to speak with your doctor about that. What that does is it restores elasticity because it increases blood flow in the vagina. Topical lidocaine, sometimes that may be helpful on the outside of the labia. There is a drug called Sphena, okay, and what that does is it is specifically designed for dyspareunia, which, as I mentioned before, is painful intercourse. It is a precursor to estrogen and progesterone, so that may help a bit, but you do need, please speak with your physician about this. Not everyone can take these. Urinary issues. There's an increase in vaginal bacteria, which causes an increase in urinary tract infections. That's not uncommon in menopause. There's an increase in the chemical environment, we call it the pH of the vagina. Dysuria, painful urination. Nocturia, increased urination at night. Urinary frequency, urge, and stress incontinence. Prominence of the urethral meatus. The urethra is a little organ tube that urine comes out of. In a menopausal woman, if anyone has ever taken a look at the urethra and you see what it is when you're younger, it's much smaller. When we become older, it gets larger, almost like a button. And sometimes there's something called a urethral chronicle that is on the urethra. It looks like a little button. That's totally normal. It's benign, but that's not abnormal in menopause. Treatments, again, for urinary issues, believe it or not, vaginal estrogen can decrease urinary tract infections. Botox, our urogynecologists in the area are wonderful here, and they use a lot of Botox for this. Hormone replacement, and I'm going to speak a lot about hormone replacement later on during the presentation. Something called hyaluronic acid, Reverie, that's the trade name for it. You can get that from Amazon. And what that does is it attracts water to the vaginal walls and it plumps up the vaginal walls so you have waves, okay, instead of a flat seashore. Okay, body weight changes, and this is a big one, okay? Lean body mass decreases, and that's mostly related to aging and what we call a sedentary lifestyle. When we get older, there are a lot of different issues that we're dealing with, aging parents, young children, grandchildren, and as time progresses, we may not have enough time to exercise, so that can be part of it. Changes in body fat distribution. Unfortunately, women are more likely to experience body fat distribution. There's an increase in abdominal fat, an increase in the visceral fat, and the visceral fat is fat around the internal organs. Elevated body mass index. Treatments. Healthy diet. I use the term diet. It should be a healthy eating lifestyle. I'd like to use that term instead. There are a lot of different diets on the market. A lot of them are fad diets, and they may have weight reduction for you in a week. You lose a lot of water, but it really doesn't teach you healthy eating habits. The best, I would say, lifestyle eating pattern to follow is the Mediterranean diet. Very healthy foods, very easy to follow. Not smoking, okay? Reducing the consumption of sugary drinks. There's a lot of sugar in diet sodas, not diet sodas, but coffee drinks at Starbucks, and just watch that, okay? Getting enough sleep. One thing I do want you to know is hormonal replacement does not help you lose weight. Okay, a lot of women will come to me, just frustrated, and I understand that a lot. I've tried everything and I can't lose weight. Hormone replacement doesn't help with weight loss, but it helps with a lot of other things, okay? Sleep changes, okay. Sleep changes could be affected because you have hot flashes known as vasomotor symptoms, which keep you up at night with night sweats. And what happens with that is the hot flashes, I'll talk about the hot flashes. They start really in the upper body, and they could be debilitating. You could be at work or you could be at a meeting, and all of a sudden you have this flushing feeling. And I'll talk a little bit more about that later. Lack of sleep can cause fatigue, irritability, difficulty concentrating, difficulty falling and staying asleep, difficulty waking up refreshed. A lot of treatments are really lifestyle changes. There's a purchase of a white noise machine may help. There is an app called Calm, which my patients have told me is very helpful. Bedside fan, light pajamas, cooling sheets you can get from Amazon or you just type in cooling sheets on your computer and you'll find them. Ice packs under your pillow. Relaxation techniques such as yoga. The 15-minute rule is try to take nice deep breaths in through the mouth, out through the nose, in through the nose, out through the mouth, 5 to 7 times a minute, but not more, because we don't want you to hyperventilate. The other thing is, if you don't fall asleep within 15 minutes, get up, okay, go to a quiet place, leave the bedroom, read, listen to quiet music. Try not to turn on the iPhone, the computer, because that will interfere with your sleep. Avoid stimulants such as caffeine, alcohol, and nicotine. Believe it or not, the stimulant effect of caffeine can last in your body for 20 hours. Use the bedroom for sleep and sex only. Okay, hair changes. Okay. Oh, the other thing I want to tell you is most adults need between 7 and 9 hours of sleep. That's not always easy to get. Hair changes. The scalp hair could be thin, but however, there could be, at the same time, unwanted facial hair, and that's known as hirsutism. Treatment. The goal is not to get more hair growth, it's to prevent the progression of hair loss. Minoxidil can be ordered with we recommend you consult with a dermatologist for this, because a lot of times there are vitamin deficiencies that you're not aware of, and they could easily be taken care of. All right, skin changes can be the result of UV exposure, smoking, pollution, poor diet, sleep deprivation. Decrease in estrogen, produced by the ovaries can cause skin changes. There's a loss of collagen. Treatments, again, healthy diet, stop smoking, cream-based moisturizers, ceramides, hyaluronic acid, which attracts water, shea butter. The best kind of moisturizers to use are moisturizers that don't pour out of the bottle. Just turn it upside down. If it doesn't pour out of the bottle, it's a good moisturizer. Excuse me. There are some offices that will do dermabrasion, peeling agents, Botox. Botox could be good for 3 to 4 months, but you have to keep up with it if you don't want any changes. Dermal fillers, that can last up to 6 to 18 months, and plastic surgeons and other spas can do this, but they have to be certified. In-office treatments such as radiofrequency and ultrasound, they can take 6 to 9 months to see effects, but if it's important to you and it's disturbing you, I would seek out these treatments. Brain fog. Okay, I'm hoping I don't have brain fog during this presentation because brain fog usually occurs, and I don't know if any of you have experienced this. You may be in the middle of a sentence and what did I just say? Well, what was I talking about? That's brain fog, okay? About 40 to 60% of women report this during the menopausal transition. Difficulty remembering words, names, numbers, inability to focus and concentrate. Causes could be sleep disturbance, depression, and anxiety. Brain fog is not typically an initial sign of dementia, okay? Cognitive changes are very typical manifestations during perimenopause and menopause. Treatments, this is easier said than done. Moderate physical exercise, you don't need to do crazy exercises. They recommend 150 exercise minutes a week, but that can be split up. Walking is good. Light weights. Weights are very important for bone density. I'll talk about that soon. Maintain a proper body mass index. Once again, the Mediterranean diet. Hormone replacement therapy is not recognized to alleviate cognitive issues because, as you'll find out later on in this presentation, there's a risk for dementia in women over 65 who continue to use hormone replacement. So I'll talk about the benefits and the risks. Intimacy issues, dyspareunia, again, painful intercourse, decreased or delayed orgasm, decreased libido. All of these are multifactorial. We're not the same people that we were when we were in our 20s. Our bodies are different. Our partners may be different. They may be changing too. So intimacy issues could be, I don't want to have intercourse because I don't want to be intimate because intercourse is too painful for me. Or I view my partner differently. Treatments could be couples counseling, hormonal treatments that I'll talk about. Testosterone is very controversial. I'll speak about that soon. I do have some women who swear by it, and I try to counsel them the best I can, but they're aware of the risks. There is an app, and you may want to take this down, called Rosy, Rosy. It's really good. They have a lot of good information on what to do with intimacy issues. There are people in the area that specifically deal with intimacy issues. That's outside my realm of experience, but I do refer my patients. Depression, okay? I know this sounds terrible, all these things that are happening, but I'll tell you how we can help you with them. Changes in hormonal levels. Estrogen can elevate and then come down, and you may have the hot flashes. Physical and psychological changes. Life stresses can cause depression. For example, caring for aging parents, children leaving or maybe even returning home. Financial issues. Am I going to have enough money in my retirement? Body images. Why do my thighs have cellulite? I didn't have it when I was in the 20s. And it's a matter of, yes, acceptance that our bodies are going to change. Relationship problems. The best treatment I could advise you is talk with your healthcare provider. Antidepressants can be very helpful for this. Psychotherapy, exercise. Exercise releases a hormone called endorphin, which can improve your mood. Okay. Bone health. Okay. I know you had a wonderful presentation a while ago on osteoporosis. I just want to touch upon a few major points. Couple of definitions. Osteopenia means weakened bones. Osteoporosis is low bone mass and altered bone structure and quality. The average bone loss is approximately 2% beginning 1 to 3 years before menopause, and it can last 5 to 10 years. The rates of bone loss are highest at menopause. By the time we reach 80 years old, a woman has lost about 30% of her peak bone mass. And approximately 40 to 50% of postmenopausal women will experience a fracture related to osteoporosis. And a hip fracture especially is associated with a high morbidity. And a lot of times 25% of women with hip fractures end up in a long-term care facility for a while because they could be very debilitating. How we diagnose this is something called a bone density scan, and that is typically done at age 65 without risk factors. However, we do start it younger if someone is at a risk for low bone mineral density. For example, if she's been on long-term steroids for an immunocompromised position or asthma, if she has diabetes, if she smokes, if she has a history of fracture, if she's less than 127 pounds, we would recommend a bone density scan before age 65. There is something that is called the FRAX score. So if any one of you have ever had a bone density scan, a lot of times you'll see a little report that says FRAX score. The FRAX score gives a risk of, based on a lot of different characteristics, such as smoking, age, history of fracture, but it gives a risk of a major osteoporotic fracture, a lifetime risk. And if you have a lifetime risk greater than 20% for a major osteoporotic fracture, or a lifetime risk more than 3% for a hip fracture, treatment is strongly recommended. And I'll talk about some treatment here. There are medications if warranted. There are weekly or monthly pills that you can take. There are IV, intravenous preparations, such as there's a drug called Prolia that's done twice a year by an IV infusion. Some of these drugs will prevent further bone loss. Others, such as Prolia, will build bone. Okay, so that's very important. Calcium and vitamin D recommendations. If some is good, too much is not good, okay? The recommendations for women who are not vitamin D deficient is 600 international units, that's IU, a day for women ages 51 to 70, and 80 international units a day for women over 71. Calcium requirements, 1,200 milligrams a day for women over 51, preferably through diet. If you take too much calcium, you are at a risk for calcifications, calcium deposits around the heart, and kidney stones. We recommend that you try to get your calcium through diet. And there, on all food labels, you can see the calcium numbers. If it doesn't add up to 1,200, you may want to take a supplement. Many supplements are also accompanied with vitamin D. So that's very important. Lifestyle changes, weight-bearing exercises. A lot of people think that weight-bearing exercises are going to make the bones denser. What they really do is they support the bones by making the muscles stronger. Again, proper diet, stop smoking. Smoking can contribute to osteoporosis as well as early menopause. Okay, now the biggie, okay, that I get a lot of questions about, vasomotor symptoms, hot flashes, night sweats. They are a sudden intense sensation of heat, particularly in the upper body, face, neck, and chest. It can last anywhere from 1 to 5 minutes. You may feel that, oh my God, I'm having palpitations. What's wrong? You can have palpitations with hot flashes, you can have chills, perspiration. Anyone who has heart palpitations, of course, you should see your doctor immediately for that. Health-related outcomes, there's a clear effect of vasomotor symptoms on key quality of life issues such as mood, sleep, cognition, risk of cardiovascular disease, and poor bone health. There are a lot of treatments for vasomotor symptoms. Not everyone is a good candidate for hormone replacement treatment. For example, anyone who has a history of breast cancer, absolutely not. Lifestyle changes, these are non-hormonal treatments. Avoid warm rooms, hot drinks and foods. Avoid alcohol if you can, and caffeine. Wear light, breathable fabrics. Use paced respiration, slow, deep abdominal breathing. Bedside fan, frozen peas under your pillow. Okay, there are also things called cooling sheets that you can get that are keep the bed nice and cool. Soy is recommended by some. The evidence is out on that. Some studies say it may decrease your vasomotor symptoms, but they're not really conclusive. Black cohosh, acupuncture, dong quai, evening primrose, they typically have what we call a placebo effect. Unlikely to decrease the vasomotor symptoms, but some women do use these and they say my symptoms have gotten better. That could be a placebo effect. If it works, do it. Okay, that's my recommendation. Okay, drugs that are not hormone therapy, and I don't represent any drug company or anything like that, but there is a drug called Veosa, which is new on the market. I prescribe this quite a bit, and it is very effective from all the feedback I've received from my patients to decrease vasomotor symptoms. It works by setting the thermostat in the brain. With that, you can discuss that with your provider. It's a non-hormonal treatment. You need to have liver enzymes taken initially before you start the drug, every 3 to 6, 9 months during the first year of the drug to make sure your liver is not affected. Antidepressants, there are people who use antidepressants for the vasomotor symptoms, and some of them are helpful, some of them it doesn't make an effect. It doesn't have an effect. Other drugs such as clonidine and gabapentin. Okay, now the hormones, okay. Hormone therapy, there are a lot of benefits to hormone therapy, but before I talk about that, I just want to tell you a couple of studies. A long time ago, there was something called the Women's Health Initiative study, and what they were aiming to do is to see if hormone replacement helped strengthen the heart or was positive for the heart. What they found out was it wasn't, and all these women stopped their hormones because of that. They revisited the study and they found out, wait a minute, we did this study on women in their 60s, late 60s and 70s, and the number one morbidity with women this age is heart disease. So they said, we don't think the hormones are related to that. So then they revisited it again. And what they recommended is if menopausal or premenopausal symptoms are interfering with the quality of life, and many times they do, then hormone replacement therapy is recommended, the shortest dose for the shortest period of time, usually 5 to 10 years during menopause or perimenopause. If it started in women over 65 years old, then it's going to increase the risk of cardiovascular disease. So it's not recommended more than 10 years or for women over 60 to 65. It also increases the risk of dementia if used over 65, and it may slightly increase the risk of breast cancer if used for more than 4 to 5 years. However, hormone replacement has wonderful benefits. Risks, okay, and your provider would tell you this. It may increase the risk of stroke or blood clots. It may increase the risk of dementia. Has a slight increased risk in breast cancer. It may increase the risk of heart disease, again, if it's used long-term. Hormones, there are a lot of different formulations of hormones. They can come in pills, patches, vaginal rings, sprays, vaginal creams, and they have to be prescribed. But the most important thing I can tell you is you need to discuss this with your healthcare provider. Hormones are not for everyone. The other thing I do want to tell you is please talk with a certified physician or a certified practitioner, nurse practitioner, who has experience in hormone replacement therapy. There are a lot of places that you can get hormones online. I have a little bit of concern about that because you really have to make sure you take a complete history. You know, if you have certain conditions, you shouldn't be on hormones. There's something called, you may hear the term bioidentical hormones. That is just a term used by marketing, okay? It has no clear meaning in terms of hormone replacement. But if people say, I need bioidentical hormones, they're the hormones that we prescribe that mimic the hormones that the ovaries make. That's different from compounded hormones. Compounded hormones you get at a compounding pharmacy. Our organization, the American College of Obstetricians and Gynecologists, does not recommend using that because they're not FDA approved. And the labeling, they're not required to describe the risks and side effects. And there's no evidence that they slow down the aging process. Now, there's something called testosterone pellets. They're implanted under the skin. They release hormones for 3 to 6 months. It helps with libido, from what some studies say. It contains estrogen and testosterone. It's the testosterone that can have an effect on libido, but their side effects are acne, thinning of hair, and water retention. Pros for these pellets. Patients like them for convenience. Okay, they contain estrogen and testosterone. Initially, there's a feeling of a surge of feeling wonderful, but this doesn't last, and typically it's not maintained with subsequent pellets. They have not shown to be safe. The cons of using pellets, they're unregulated. Again, they're not FDA approved. They can cause water retention, breast tenderness, facial hair, acne, and thinning of the hair. I know I have some patients who are seeing specialists and they are on the pellets, and the best I can do is just tell them about the risks. And some women do swear by them. I just have to be honest with you. I don't prescribe them because they're not FDA approved. Okay, now I know I spoke a lot and fast. I apologize for the initial slides if you couldn't see them. Here are some really good menopause books, okay? The Menopause Brain, The Longest Imperative, The New Menopause, Estrogen Matters, apps. That's the Rosie app, emphasizes issues with sexuality. There's a great podcast by a doctor, okay? Please stay off TikTok for menopause suggestions. Get on a podcast, and it's called the Menopause Rescue. All right, I'm going to leave this to, how are we doing on time? Oh, we're good.
Yeah, we're doing really good. And
yeah.
we can definitely go over as well.
Oh, I
to make
can't
up
go
for...
over. I'm sorry. Yeah, I have
Oh,
patients
okay.
at 1 o'clock. Yeah, I apologize. But questions, can I help?
If anyone wants to have any questions, you can just type it in. We'll read them out loud on our end.
Okay.
Okay. One question reads, what do you think of monk's pepper for menopausal symptoms, and how many milligrams should I take? Also, should it be taken in the morning or in the evening?
I'm not familiar with that. I have to be honest with you.
Are there any other questions? We'll just give it a couple more minutes.
Yeah. I hope this was helpful. I just wanted to give you an overview and certain things that you can do to help.
Yeah, I think we learned a lot. It was a great presentation. A lot of really helpful information. Things that, we have one more question.
Go ahead.
Another question. Do we get a copy of the recording? Yes.
Yes.
Yep, we'll be sending out a copy of the recording to all of the attendees following the end of this presentation.
And if anyone has questions, again, I can't give you medical advice if you're not my patient, but if you have a question, you can contact me at Stony Brook Medicine, OBGYN, and if I can answer a question or direct you somewhere, I'd be happy to help.
Great. Thank you so much.
All right, thank you.
No problem. Have a great rest of your day.
You too. Bye now.
Bye. Oh, we have one more question.
Go ahead.
What was the way to contact?
University Associates in OBGYN. I'm at the Lake Grove office. I'll give you the phone number for the office, okay? It's Dr. Snyder, and I'm in Lake Grove in Bohemia, but the same office number is, here we go. They just changed it. I apologize. Hold on a second. It's 631-444-4686. When you call, the wonderful nurses will take a message and send it to me.
Great. And we have another question as well.
Okay.
Is there reliable online resources? There's so much varying information, and my doctor is too busy to assist me. Okay.
You can take this down. I should have written this down. There's something called the North American Menopause Society, NAMS. Excellent information on menopause. That's the first one. Again, it's NAMS, North American Menopause Society. The other is the American College of Obstetrics and Gynecologists, called ACOG, ACOG. They have a wonderful website with a lot of questions, a lot of information on menopause. Again, it's ACOG. If you feel your doctor doesn't have, a lot of times people don't have the expertise in it, but they have expertise in things that I may not have expertise in. Ask them, do you know a physician who deals with menopause? You really, it's your right. And don't ever let anyone think you're having these symptoms. Oh, you're just going through menopause. Yeah, you're going through menopause, but you may need assistance with that because a lot of times it's very life-changing.
Thank you for
Are
the
there other questions?
We're not seeing any at the moment, and it
Okay.
looks like there was a delay of a couple minutes. But I think since you do have your patients, I think we're at a good stopping point. And I'll also include information about NAMS and ACOG in the recording email too.
Yes, and I'd be happy to.
Pretty afraid they're gonna censor them.
What was that?
We'll also be including information about NAMS and ACOG in the recording email too.
Okay, I have a couple of minutes for any extra questions. They're not coming until 1. Anyone else have a question? And I don't feel embarrassed to ask.
I will just give it a couple of more minutes.
Okay. I'm sorry for the technical difficulties, but I'm glad we worked them out.
Yeah, we had a couple things on our end. So now we know of a couple extra steps to take to make sure they don't happen in the future.
Yeah.
Oh, we have one more question here.
Okay.
Is there a good OBGYN for online consultations?
Not for our practice, but if people want to come into the office and establish themselves, then after they establish themselves, we have a wonderful portal where the patient can contact us with any questions, but they have to be established right now.
Thank you. We have another question too. Any concern with liver testing and VEOZAH? I believe that's spelled VEOZAH.
Yes, that's why we have to do liver enzymes because it can elevate the liver enzymes. Okay, so we have to make sure that the liver enzymes are within range with the VEOZAH. But that is a really great drug. And again, I don't sell VEOZAH.
That's still good to hear. We have a couple more questions.
Okay.
What type of calcium do you recommend?
Caltrate is great. It's absorbed much easily. CALTRATE.
Great. Then another question, are swollen feet a symptom of menopause?
Yeah, they can be, it could be water. A lot of times there's water retention, but anyone who has something like that with any other symptoms, I would check, make sure you have your annuals and everything like that. It could be an indication of what we call edema, which is not related to menopause, but we do see swollen extremities in menopause.
Okay, and one more question. Is VEOZAH covered by insurance?
A lot of times it is. But when you see your provider, they will give you a card and you can call your insurance company. I've had patients on Medicaid who are covered with the VEOZAH, and they can provide you with some coupons as well. But it's something for women who don't want to take hormones or can't take hormones. I would strongly recommend that. There'll be other drugs on the market, I'm sure, but this is the newest one that deals specifically with vasomotor symptoms, and it really helps the hot flashes, and it can be life-changing.
Great. And we just have a couple more smaller questions coming in. First question, is Caltrate the brand for calcium?
Yes, yeah.
Great.
It's calcium carbonate. That's the generic term.
Okay. And is the patient portal usable for people using screen readers or people with other disabilities?
Yes, absolutely. When someone establishes a patient here, they just bring their phone. We can set them up with the portal. It's so easy to use. And then they can get in touch with their providers just by sending a text message, because if you call, it's gonna, sometimes you're on the phone for 20 minutes. But I never leave the office without answering my text messages from the patients. I try to do that as much as possible.
Great. So I think we're right. Our clock says 12:59. Oh, one more question. It
Okay.
just came in. I also have cold flashes as well as hot flashes.
Yep.
Is there a treatment for that?
Warmer clothing when that happens. Seriously, and that could be from the perspiration as well. And it can also be, I would recommend getting a thyroid checked if you're feeling cold too.
Yep. That does sound like it could be a symptom of hypothyroidism as well.
Yes, exactly.
Yeah. All right. I think where our clock says 1 o'clock, so I think this is a good stopping point.
Okay, I hope this was helpful. I appreciate feedback. With the slides too basic? Was it too fast? Because that'll only help the next presentation.
Yeah, we'll pass along any feedback we get.
Okay, all right, it was a pleasure. Thank you so much.
Of course. Thank you so much, Dr. Snyder.
Okay.
Thank you for being with us today. We hope to have more presentations with you in the future.
Okay, thank you. Bye now.
Bye.